About suprascapular nerve anatomy and where to block the nerve. The nerve can be blocked at different places, anteriorly and posteriorly, and the outcome will differ depending on where you block it. So the anterior approach, which I've covered in a separate video, is used when you want a comprehensive shoulder blockade for all the parts which is supplied by the nerve, because none of the branches have taken off at that point when we block it anteriorly. So the anterior approach blocks the nerve as it comes off the upper trunk of the brachial plexus, and hence you get most comprehensive coverage of all the parts supplied by this nerve, mainly the posterior superior part of the shoulder. Now, as the nerve travels posteriorly, it travels through the suprascapular notch. If you block the nerve at this point, you might still miss the acromial branch. And what does the acromial branch do? The acromial branch goes and supplies the acromioclavicular joint and sometimes the upper part of the shoulder. So this might be missed unless the local anesthetic tracks proximally and blocks this branch as well. As soon as the nerve has traveled through the suprascapular notch, it divides into a medial and a lateral branch. Now, the medial branch does not give off any articular branches, and it supplies the anterior part of the supraspinatus muscle, which is very important for abduction. So, the lateral branch, it supplies the posterior part of the supraspinatus muscle, which is important for shoulder stability, and it also gives off lots of articular branches. Now, if you're blocking the nerve in the supraspinous fossa and you target the nerve midway or distally, then you might spare the medial branch, which clinically means that the abduction function of the shoulder might be preserved, and hence functionally you might be a little better. If you target the nerve at the spinoglenoid notch, which is the next level, so the nerves is going from the suprascapular notch, from the supraspinous fossa, where it divides into medial and lateral, and then it goes into the spinoglenoid notch and then goes inferiorly to supply the infraspinatus muscle. So if you target the spinoglenoid notch, you're blocking the articular branches and the infraspinatus, and hence you're being selective. So what approach you use depends upon why you're blocking the nerve and what treatment are you doing. Apart from the blockade, we often use radiofrequency ablation or cryoablation, which can lead to long-term dysfunction of the nerve, and hence being selective becomes important. And I've covered these approaches in separate videos as you have seen previously. So be wise and select your targets carefully, because that's what will determine the final outcome of your block. So more details of these nerves and their branching is given in the reference below. I think you should read that. It's a very good paper. This is our Dr. Amod Manocha signing off. Stay connected for more educational content like this.